next discussion. Travellers visiting the Western Cape ahead of the Easter holiday break should adhere to COVID-19 protocols to prevent a third wave. That's the warning from Health MEC Dr. Noah French-Mbombo, who's urged holidaymakers to avoid crowds and super spreader events. The Health Department says the Western Cape is between waves, with 2,460 active cases and a declining death rate. But it says cluster outbreaks in the Cape Winelands remain a concern. Let's unpack the story for you now. We're joined by the head of the Provincial Health Department, Dr. Cloete, via our video link in Cape Town. Good morning to you once again, Dr. Cloete. Thanks very much for your time this morning. I mean, it's a difficult one, isn't it? Because we're all looking forward to a bit of a break over the Easter holidays. Perhaps we haven't seen our families in some months, but then we have to weigh it up against the very real risk of a third wave of infections.
Good morning, Michelle. Yes, I think the message is really one of vigilance.
Yeah.
And we can understand it's been a long time, the first and the second wave. In a sense, Christmas and the holiday periods around December was almost postponed. So you can understand that people are looking forward to holiday periods, but we are saying COVID is very much with us, and the risk of infection and the spread of infections and starting a third wave is very real.
Dr. Cloete, if you could have it your way, would you say let's all rather just stay at home?
If we had it our way, we would advise people to stay at home. We would advise people to do, if they have to gather, the smallest possible gathering, preferably outdoors, and observing social distancing and masking at all times. But preferably, stay at home, stay in your own bubble. Because the only thing that you have security is the people immediately around you, and that's the only way that you will make sure that you don't introduce COVID into your own immediate space.
Yeah. Are you seeing a trend of people, yes, they are gathering safely, they're doing so outdoors, they perhaps are mixing with only a certain amount of people, as you say, in their bubble, but perhaps, you know, they are not adhering to perhaps those social distancing norms. Perhaps they're hugging too much. Is that now becoming a real risk for you?
The bigger risk is actually all of those together, Michelle. So I think people understandably are fatigued by observing all these rules. But we have seen, and then the recent Newzroom study has shown that mask wearing is only at 40% of people. Now that is low. And then the social distancing and hand washing and hygiene is even lower than that. That means only 4 out of 10 people actually observe mask wearing at any given time. And also when people are together, less than 4 out of 10 people actually are mindful and intentionally avoid avoid coming into close contact with others.
Yeah.
So if you put that together with the fact that there is level 1 restrictions and there's holiday, the automatic human response is to let your guard down. And what we're saying is it is exactly at times like this that we should actually heighten our guard to make sure that we secure our bubble and maintain social distancing and mask wearing at all times.
And it's all of the things you've described, plus, let's say, the addition of alcohol?
Yes, so one of the biggest things that we've learned from COVID, and we've been tracking it very closely in the Western Cape, is the impact of the availability of alcohol. So I just want to stress it's the availability of alcohol, because once alcohol is available, it is associated with irresponsible use of alcohol. So obviously the habits and the behaviors that goes with holidays, freedom of movement and availability of alcohol, you put all of that together, you then have, in a sense, a festive environment of people not observing vigilance in terms of how they behave.
Yeah. The Western Cape is doing well in terms of the number of active cases at the moment, just under 2,500 active cases. I see the death rate in the province is also declining. What are you predicting? Because surely you're also working off of models to predict how the next few weeks will unfold. What do those models say, and what kind of preparation is underway?
Yeah. So we're very blessed in this province to have highly competent and highly skilled infectious diseases epidemiologists. They also work with the National Ministerial Advisory Committee on specifically this topic of preparing for and putting measures in place for the third wave. So there are 6 things that they're looking at. The first one is the change in season and holiday season. So that's why we're making this heightened call for the first of these drivers of what happens for the third wave. The second one is this connection with people and the movement of people. So again, Easter represents that because people move between provinces, they move between rural and urban and all of those. And then the third one is really about the fact that we are in level 1 and the restriction internally where people are is down. So those are the 3 key drivers. But then there's 3 more scientific drivers. The fourth one in this hierarchy of 6 things is really how much antibodies or protection does people have following the first and second wave. So we are doing a seroprevalence survey, and we will be making that available next week. And we will then know what is the risk in various communities based on the seroprevalence of how many antibodies people have. And then the next one is the one that, in a sense, caught us off guard in the second wave, and that is the emergence of new variants, like 501v2. And then the last one is, if vaccines take-up is sufficient, we could actually start protecting the vulnerable.
Yeah.
So we're putting all of those together, Michelle, and our prediction is that's why we want to delay the onset of the third wave, because the more vaccines we can get into, which is getting into the second phase of the healthcare worker vaccine by accelerating that, and then getting into phase 2, targeted at the elderly, that gives us the best chance of mitigating against the third wave.
Yeah.
So the model is, at this point in time, is putting all 6 of those factors together, and therefore we are vigilant, and we're looking at delaying it as much as possible, and then possibly having the upswing only towards the end of April, beginning of May into June. It gives us a time to be able to mitigate effectively against it.
I'm glad you bring up the issue of vaccines, because there's been, as the Deputy President himself said yesterday, visiting your province, there's been a delay in the amount of vaccines we would have hoped to have administered by now already. In fact, we wanted to have vaccinated 1.1 million people by the end of this month. We're only at just, I think, almost 180,000 healthcare workers.
So, yes, so in our province, we have 132 or 134 healthcare workers that, 134,000 healthcare workers that we would have wanted to have vaccinated if the vaccines were available and we were geared to be able to have done it by the end of this month. What has happened? We're very grateful that we have the Sosomke vaccines, but we've only had 31,000. You can imagine we have 134,000 and we've only had 31,000. We're using all the doses that comes to us. We have topped 2,000 vaccines in one day, 2 days ago at 9 sites. That gives us the sense that if we were at 20 sites, we could have done 3,000 or 4,000 vaccines, about 10 to 20,000 vaccines per day if we had the vaccines. So we are very much gearing up for an acceleration in April to make up for lost time for healthcare workers, and then gear up for May for many more sites. So we planned right up front to be able to go to 300 sites in this province to be able to do the required dosages per day, depending on the availability of vaccines, to get to the most people in the quickest possible time.
Dr. Cloete, what can you tell us, that perhaps is not in the public domain in terms of our ability to get the vaccines to South Africa? What is the big delay? We know the minister has spoken to us about delays in pharmaceutical companies in manufacturing, but there are so many other countries that are well into their vaccine rollout plans. We are lagging so far behind.
Well, I think it is in public domain, Michelle. I can't add anything more that's already in public domain. And that is that most of the first world countries, in a sense, got conditions and agreements with most of the biggest producers of the vaccines, which entitle them to the amount of doses that they have. So if you look at the uptake across the world, the biggest uptake has been in the US, the UK, and then in Israel, a very small country, and the UAE. Those are all countries that had pre-agreements with the producers of vaccines. The second big thing, and therefore, in a sense, like all the other countries that didn't have the pre-agreements, have now got to compete against these producers and manufacturers that have commitments to all those countries to start getting into that pipeline is what the Deputy President and the Minister and the President has been articulating to us. The second thing is our regulatory authority, because we in this country have to have a regulatory authority to make sure, and that is SAPRA. And again, you saw we were ready with Covishield, but then because of our variant, it was not as effective. We had to put that on hold. So all these factors mitigate against us. So it's about the availability internationally and what the manufacturers are willing and able to do. It's a very skewed relationship at this point in time because they hold all the cards. They basically can actually decide which country gets, which country doesn't get. And that's unfortunately what we're joining at this point in time. And then internally, having the regulatory authority to make sure that we have the safe and the most appropriate vaccine for our context.
Yeah, it's incredibly frustrating, Dr. Cloete, but in the midst of what you're describing now, and then the upcoming Easter holidays, you know, people wanting to gather, you also talk about 4 out of 10 people adhering to mask wearing as an example of those non-pharmaceutical interventions. Given what you've just described to us in terms of our vaccine rollout plan, what is your message not only to your province but to our country as we gear up for an Easter weekend, as we gear up for the next few weeks?
My message is a very simple one. We have it in our hands to decide what the outcome of this country is in terms of the third wave and how we actually manage what comes at us. So everybody has the power to keep into small bubbles, to adhere to mask wearing, social distancing, and to prevent the spread of COVID. And if we delay that, it gives us the time to get the vaccines, to be able to vaccinate, and to prepare appropriately for the third wave so that we can mitigate the impact, especially on the most vulnerable people, that if we have another third wave, the ones that's likely to be admitted and die in our hospitals.
Yeah. Incredibly important message there. Dr. Keith Cloete, thanks so much for your time this morning. He is the Western Cape Health Department's HOD as we continue to build up to the Easter weekend and what that means for the possibility of a third wave of infections. Thanks very much indeed.